Good morning. Welcome to Medical Terminology. We will be discussing about Module 1, which is Introduction to Medical Terminology. The following are the topics that we will be discussing in Module 1. The rules of pronunciation, the medical words or the big three in medical terminology, particularly the prefixes, the suffixes, and the root word. Building a medical vocabulary, root words for each system pertaining to medicine, disease, and medical terminology, causes and classification of diseases, and manifestation of diseases, practice of medicine in allied profession and technical occupation, diagnosis of diseases, treatment of diseases, some drugs used in medicine, and the branches of medicine and surgery. When we say medical terminology, it is a very special way of communication or words or vocabulary that healthcare professionals like us use for effective and accurate communication. It is mainly based on Greek and Latin words and is consistent and uniform throughout the world. That means what medical terminology we are studying here in the Philippines are also the medical terminologies that you will be encountering once you work in abroad. Okay. And you must remember that most of the terms are of Latin origin. Okay? Due to the fact that the father of Western medicine is Hippocrates, and he is a Greek. And after the Greek civilization, it is the Romans who have almost conquered the whole world. And it is the Roman language, which is Latin, that people in the Western world uses. Thus, in many writings in ancient civilization, Latin is the one being used. Medical terminology is of three parts, or what we call the big three. Okay? These are the following. First is the root word, which is the main meaning, which gives the medical terminology its main meaning. Okay? Or it is the word of which the medical term is associated with. Okay. The next one is the suffix. Okay. The suffix is a short word or letters, a couple of letters that is added to the word or to the root word at the end to modify its meaning. Okay. And lastly, the prefix. It is a short word or letters that is added before the root word to modify its meaning. So basically, a medical terminology can be consist of a prefix, a root word, and a suffix. However, it is not limited to that. Some root words have just the prefix and the root. Some have the root word and the suffix. Some have two root words plus the suffix, and some have a suffix plus two root words. Okay? So we must be able to familiarize with these word parts, okay, in order for us to build a medical vocabulary. In addition to knowing the composition of medical terminology, We also have what we call the combining form. Okay. The combining form is consists of the root word, and it is attached with a connecting or combining vowel to make it easier to pronounce or and to attach it to another word or a suffix. Okay? So an example of this is the combining form for heart is cardi or cardio. Okay? The root word is cardi. The combining vowel is o. So you have the combining form cardio. Okay? And another example is the combining form of the word cell or cells, which is site, okay, site, CYT, and the combining vowel is letter O, which give us the combining form cyto, okay, cyto. There are basic rules for combining vowel. Okay. The combining vowel is not used when the suffix begins with a vowel. Okay, so we have the example neuritis. Okay, neuritis. Neuritis is the inflammation of the nerve. Okay, so the root word here is neur, neur. Okay, so if we will be using the combining form with the letter O, it will be neuro. However, okay, the suffix following the root word begins with a vowel. Okay, the suffix itis. Okay, itis meaning inflammation. Okay, if that is the case, okay, we will not be using the combining vowel O. Instead, we just attach the root word and the suffix, which will give us the term neuritis. Neuritis. Okay. And on the other hand, okay, the combining vowel used when the suffix begins with a consonant. So in the second one, okay, the combining vowel is used. Okay, as long as the suffix begins with a consonant. Okay, so consonants are letters aside from the a, e, I, o, u. Okay, so the example given is neuroplasty. Okay, so neuroplasty is the surgical repair of the nerve. Okay, so again, we have the combining word or combining root word, which is neuro, neuro pertaining to the nerve, and we have the plasty, which means reconstruction or repair, surgical repair. Okay, giving us the word neuroplasty, which means surgical repair of the nerve. Okay, next we move to the pronunciation. Okay, a vowel, okay, gets a short pronunciation if it has no pronunciation mark over it, such as a as in hat, e as in met, e as in bin, o as in some, u as in run. Okay? On the other hand, a short line over the vowel gives it a long pronunciation. Okay, a as in say, e as in t, lie as in I as in lie, o as in hose, u as in sue. Okay? So that is pronunciation of vowels when we see the pronunciation mark over the vowels. Okay. In addition to medical terminologies, or in medical terminologies, we also use abbreviations. Okay. Abbreviations, like symbols, can save time, but they can also cause confusion if they are not used or understood universally. Okay, so we will be studying abbreviation that is universally understood in order for you to uh, communicate well in the future, okay, in the clinical setting. Okay. So usage of this abbreviation tends to varies in different healthcare institution, okay, and the same abbreviation may be of different meaning in different professions or fields. Okay? Like abbreviation, okay? Or an example of an abbreviation is an acronym. Okay? An acronym is formed from the first letter of each word in a phrase. Okay? Example. So the we have the acronym MRA. Okay? MRA means magnetic resonance angiography. Okay? We take the or we took out the first letter of each word in the phrase. We have M from magnetic, R from resonance, A from angiography. So we have MRA. Okay? So that is an example of an acronym. In this slide, okay, are some pronunciations, okay, that we should observe in medical terminology. Okay? We have silent letters and unusual pronunciations. Okay? The letters C and H, okay, are they are pronounced as letter K, as in chemical, chemical, okay, chemical, which means pertaining to chemistry. Okay? Chem, chemi, chemic, which means chemistry. Okay? Al or al, which means pertaining to. Okay? So the next letters are dys. Okay? Dys, which is pronounced as this. Okay? The example given is dystrophy, dystrophy, okay, dystrophy, or poor nourishment of tissue, poor nourishment of tissue. Okay, so this is given as a um, prefix. Okay, the next letters EU. EU are pronounced as U, okay, as in euphoria, euphoria, okay, euphoria, which means exaggerated feeling of well-being, okay, euphoria, okay. Next is G and N, GN, okay? Okay, when G and N, or when letter G is followed by a consonant or a letter N, letter G or G will become silent, okay? So that means it will be pronounced as N. So the example is natic, natic, which means pertaining to the jaw, okay? Natic, okay? Nat or nato meaning jaw, and IC or ik means pertaining to. Okay. Next one is PH. Okay. So in the rules of double consonant, okay, particularly letter P, okay, if P is followed by letter H, the pronunciation is letter F. Okay, as in F. Like pharmacy, pharmacy, Pharmacy. Pharmacy. Okay? It is defined as a drug dispensary. Okay? Pharmacy. Okay? Okay. On the other hand, all other um, all other double word or double consonant with the letter P followed by consonant. So letter P should remain or should be silent. Okay? Letter P will not be pronounced. Okay? So for PN, so it should be pronounced as letter N. So the example is pneumonia. Pneumonia, okay? Pneumonia, which means inflammation of the lungs. Okay. The other example is PS, which is pronounced as S. PS, silent P, then it should be pronounced as S. So the example is pseudo. Pseudo, which means false. Okay, pseudo um, is a prefix. Okay. Next we have PT. PT. Okay. It is pronounced as T, silent P. So the example is ptosis. Ptosis and not pitosis. Okay, again, it is pronounced as ptosis. Okay, ptosis means dropping. Dropping. Okay, however, ptosis, okay, in ptosis, if ptosis is used as a suffix, okay, if ptosis is used as a suffix, and the end of the root word is a vowel, okay, or the combining form ends in a vowel, okay, we must pronounce the letter P, as in neproptosis, neproptosis, neproptosis. Okay, nepro means kidney, ptosis means dropping. So if we combine those together, we have neproptosis. Neproptosis means the dropping of the kidney. Neproptosis. Okay. Next is RH. Okay, RH. So again, it is a double consonant. So the pronunciation will remain as letter R. R. Okay, so the example is rheumatic, rheumatic, okay, rheumatic, okay, which means pertaining to rheumatism or a disorder of muscles and joints. Okay, and the next one is the letter X. Okay, the letter X, it is pronounced as the letter Z. Okay, letter Z. So the example is xiphoid, xiphoid, okay, xiphoid, okay, it is pertaining to the cartilage attached to the sternum, xiphoid, okay. So that's why we have the what we call xiphoid process, xiphoid process, okay, located in the uh, inferior portion of the sternum, okay, xiphoid process. Okay, having known the rules in pronunciation, so could you pronounce the following words? Okay, okay, it's your turn now. Okay, so very good. It is pronounced as dysfunction, rheumatoid, chronologic, and pharynx. Okay, very good. Okay, in this slide, pronounce the following phonetic forms. Okay, Okay, very good. So we have narcotic, narcotic. Then we have nitrogen, nitrogen. Okay, we have surface, surface. Okay, and then we have vascular, vascular. Okay, and last we have thoracic, thoracic. Okay, very good. Okay. As we discussed earlier, okay, suffixes are words that is added or that are added in the end of the root word to modify its meaning. So a suffix may indicate that the word is either a noun or an adjective, and often determines how the definition of the word will begin. Okay, so noun suffixes. Okay, so suffixes that means condition of. Okay, the following suffixes all have the same meaning, and that is condition of. Okay, we have the suffix ia. Okay, so the example is phobia, phobia, okay, which means persistent or exaggerated fear. Okay, phobia. Okay, next the suffix ism, ism or ism. Okay, the example is alcoholism, alcoholism. Okay, which means impaired control of alcohol use or alcohol addiction. Okay, condition of alcohol addiction. Okay, or impaired condition of alcohol use. Okay, so next is the suffix cis, sis. Okay, so the ending or the suffix cis may appear with a combining vowel such as o cis, iasis, esis, or asis. Okay, the first two of these detonate or denote, sorry, not detonate, denote an abnormal condition. Okay, so meaning the OCs and ASCs, okay, denotes or denote that the word in which they are used with is of an abnormal condition. Okay, so now we proceed to the example given, which is acidosis, acidosis, okay, which means acidic condition of the body, acidic condition of the body. Okay. Next is the suffix y, okay, y, and so the example is tetany, tetany, okay, which means sustained muscle contraction, sustained muscle contraction or sustained muscle spasm, okay. So all of these are suffixes, okay, that are nouns, okay, and all of them means the same thing, and their meaning is condition of. Okay. In continuation, we have the suffixes for medical specialties. Okay. So again, these are noun suffixes. Okay. So we have the ian, okay, which means specialist in a field of study. Example is physician, physician, okay, or a practitioner of medicine. Then we have the iatrics, which means medical specialty. Okay, so the example is geriatrics, geriatrics. Okay, geriatrics means the study and treatment of old age. Okay, next is the iatry. Okay, iatry, which also means medical specialty. Okay, so the example is podiatry, podiatry, okay, which means the study and treatment of the foot, podiatry. Okay, next is the suffix ics or x. X. So also meaning medical specialty. Okay, and the example given is orthopedics. Orthopedics. Okay, so the study and treatment of the skeleton and joints. Okay, from the root word ped or pedo meaning child, and prefix ortho meaning straight. Okay, and of course X meaning medical specialty. Okay. Next is the IST or East. IST or East, okay, which means a specialist in a field of study. Specialist in a field of study. So the example is cardiologist. Cardiologist, okay. Cardiologist is a specialist in the field in the treatment study in the study and treatment of the heart. Cardiologist. And the last suffix is logi. Logi, which means study of. Study of. Okay. The example is physiology. Physiology, so it is the study of the function of a living organism. Physiology. Okay. So now we move to the adjective suffixes. Okay. So in this table, we are seeing the suffixes that means or that mean pertaining to or resembling. Okay, all of these suffixes means pertaining to or resembling. Okay, the suffix ac or ac. Okay, when combined with cardi, which is cardiac, cardiac, which means pertaining to the heart. Okay, the suffix al combined with skelet, okay, which means skeleton. Okay, it will become skeletal and which means pertaining to the skeleton. Okay, the suffix ar, muscular, okay, muscular, pertaining to the muscle, okay, muscle or musculo, okay, which means muscle, and ar, which means pertaining to. Okay, next is ari, ari, okay, example is dietary, dietary, okay, pertaining to the diet. Okay, the next one is form, form as in musiform, musiform, okay, form means resembling, okay, so that means musiform or means like or resembling a mucus. Okay, next is IC or ick, IC or ick, okay, the example given is metric, metric, which is pertaining to a meter, pertaining to a meter. Okay. Next is what we have ICAL or ICAL or ICAL. Okay. So it is merely a combination of the suffixes IC, IC, and AL. Okay. So we have anatomical, anatomical, anatomical. Okay. Anatomical, which means pertaining to the anatomy. Anatomical, which means pertaining to the anatomy. Yes. Next we have ILE, okay, the suffix ILE, okay, and it is used, the example used is febrile, okay, febrile, which means pertaining to fever, pertaining to fever, or basically in the nursing, in nursing, when we say febrile, that if a person is febrile, that means the person is having a fever or having a high temperature. Okay. Next, we have the oid. Okay, the OID or oid. So the example is toxoid. Toxoid. Okay, toxoid meaning resembling toxin or a poison. Okay, toxo. Okay, meaning toxin or poison. Okay, oid resembling. Okay, next is ori. Ori as in respiratory, pertaining to the respiration. Okay, next is OUS. OUS, okay, or us. The example is Venus. Venus, okay, which means pertaining to a vein. Venus, pertaining to a vein. Okay, and now we proceed in forming plurals. Okay, some words are used in singular form, and some words or medical terminologies are used in plural forms. Okay, so if the word is ending with the letter A or A, okay, the plural ending should be a combined letter A and letter E, okay, which also mean which are pronounced as E or A, gingiva, okay, gingiva, okay. Next is when the word ending is letter E and N, okay. So the plural ending should be instead of E N, okay, it will be I N A. So the example given is foramen, okay, and then the plural form should be foramina. Foramina. Okay. The next word endings are EX, IX, and YX. So the plural ending of these three should be ICES or I E I C E S, ICES. Okay. So the example is appendix, appendix or something added. Okay, so the plural form is appendices. Appendices. Okay. Next is the word end. If the word ending is is or is, the plural ending should be es. Example of this is diagnosis. Diagnosis. Okay. So diagnosis is the identification of diseases. Okay, and the plural ending should be es, es. So from diagnosis, it should be diagnosis, diagnosis, diagnosis. Okay, diagnosis singular, diagnosis plural. Okay. So next is if the word ending is ma, okay. Sa plural ending, it would be mata, mata, mata. So example is stigma, stigma meaning scar or mark. Okay, so the plural form would be stigmata. Okay, stigmata or stigmata. Okay, stigmata. Then we have the NX, ANX, ISX, and YNX. So the example given is phalanx, phalanx, okay, phalanx. So the plural should be phalanges, phalanges, okay, phalanges. Okay, so this means bone of a finger or a toe. Okay. So next is ON. ON. Okay. ON, which means or should have the combining or the plural form ah, ah, or from the example, spermatozoon, spermatozoon. So instead of on, magiging so that would mean spermatozoa, spermatozoa. Okay. So next is the if the ending is um, so the plural ending should be a or a. So the example is ovum, ovum. Okay, the plural uh, example should be or answer is ova, ova. Okay, ovum, ova. Okay, next is US. So the plural ending should be I. Okay, the plural ending should be I. So example is embolus, embolus. So the plural example should be emboli, emboli, emboli. Okay? Plural meaning siya ng embolus, emboli. Okay? And now we go to the prefixes. So these are words or letters that are attached at the beginning of the root word to modify its meaning. Okay? For an example, the word lateral means side. Okay? Adding the prefix uni, meaning one, forms the word unilateral, which means affecting or involving one side. Okay? Adding the prefix contra, meaning against or opposite, forms the terminology contralateral, which refers to an opposite side. Okay? And the term equilateral means having equal sides. With equi and lateral, okay, equi meaning equal, lateral means side. Okay? So that is the prefixes. Okay, so here are the prefixes for numbers. Okay, we have prime, primey, okay, which means first. Primitive is the example, primitive. Okay, then its definition is occurring first in time. So we use prim or primey when we are referring the order of time. Okay, then we have mono. Mono means one, as in monocular, which means pertaining to one eye. Okay, mono means one, ocul or oculo means eye, AR means pertaining to. So we have the medical terminology monocular. So this terminology is composed of a prefix, a root word, and a suffix. Next, we have the term or the prefix uni, which means one. So unicellular, composed of one cell. And then we have the root word hemi, hemi, which means half or one side. Okay, the example is hemisphere, hemisphere, or one half, meaning one half of a rounded sphere. One half of a rounded sphere, hemisphere. Okay, then we have semi, means half or partial, half or partial. Okay, so the example given is semi-solid. Semi-solid, okay, semi-solid. Okay, semi-solid means partially solid, partially solid. Okay. Next we have bi or bi, okay, which means two or twice. We have the example bicuspid, bicuspid, okay, bicuspid, meaning having 2 points, or a tooth having with 2 points or two cusps, okay, bicuspid. Okay, we also have the prefix di, di, okay, which means also two twice. Okay, the example is dimorphous or dimorphous, sorry, it is dimorphous, dimorphous, okay, having two forms, having two forms, dimorphous. Okay, next we have diplo or diplo meaning double, right? Diploid, having two sets of chromosomes, diploid, having two sets of chromosomes, okay, or double chromosomes. Okay, now next is tri. Tri, which means three, triplet, triplet. Okay, one of three offspring produced in a single birth, triplet. Next we have quadri, quadri meaning four. Example is quadrant, quadrant or one-fourth of an area, one-fourth of an area, that is quadrant. Next we have tetra, meaning also four. Tetra, four. We have tetrahedron, tetrahedron. Okay, a figure with four surface, a figure with four surface or tetrahedron. Next we have multi, which means many. Okay, multi, which means many, multiple, multiple. Okay, consisting of many parts, multiple. Then we have poly, poly, which means also many or much. So the example is polysaccharide, polysaccharide. Okay, a substance composed of many sugar. Poly means many, saccharide means sugar or starches, many starches or many sugar, polysaccharide. Okay, so that are prefixes for numbers. Now we move to the prefixes for colors. Okay, prefixes for colors, we have cyan, cyano, which means blue. Okay, so the example is cyanosis, or the bluish discoloration of the skin due to lack of oxygen. Cyanosis, cyanosis, okay, cyano, blue, cyano, blue. Okay, erythro, erythro red, erythrocyte. Erythrocyte, which is a red blood cell. Okay, erythro red. Next, we have the prefix leuco, leuco, okay, which means white or colorless, leuco, leuco, okay, leuco. Leukopenia or leukoplakia, leukoplakia, okay, which means white patches in the mouth, white patches or patches in the mouth. Leukoplakia, leuko, which means white, leuko, white. Okay, melan or melano, melano, which means dark or black, dark or black. So we have melanin, melanin, okay, melanin, the dark pigment that colors the hair and the skin, melanin. Melano means dark or black. Next we have santo, santo means yellow, santoderma, santoderma, which means yellow discoloration of the skin, yellow discoloration of the skin, santoderma, okay, santo meaning yellow. Now we have the negative prefixes. Okay, we begin with the prefix a and an, which means not or without. Okay, example is aseptic, aseptic, which means free from infectious organism, free of infectious organism, aseptic. Okay. Next is we have anti, anti which means against, anti which means against. With the example antidote, antidote, okay, which means counteracting a poison, counteracting a poison, antidote. Anti means against, anti against. Okay, contra meaning against or opposite, contra meaning against or opposite. We have contraception, contraception, okay, prevention of conception. Okay, prevention of conception is contraception, contraception, which means against or opposite, contra. Okay, next we have de, okay, de, which means down or without, down or without, de. Okay, the example is depilatory, depilatory, okay, depilatory, which is agent used to remove hair, peel or pilo, pilo, which means hair, okay, so depilatory means agent used to remove hair or a substance used to remove hair. Again, de means down, de means down or without, de means down or without, de. Next is dis, dis, okay, dis. The prefix dis means absence or removal or separation. Again, the absence dis or dis, okay, the prefix the prefix dis or dis means absence, removal, separation. Absence, removal, separation. Okay, the example is in dissect, dissect. Okay, dissect, which means to separate tissues for anatomical study. To separate tissues for anatomical study. Dissect, to separate tissues for anatomical study. Okay, dis, dis means absence, removal, separation. Prefix dis, dis. Next is in or in, okay, which means not. Okay, in or im means not. Okay, example insignificant, insignificant, which means non-important, not important, insignificant. Insignificant, in or im means not. Next is the prefix non or non, non, N-O-N, okay, which means also not, okay, non, okay, non-infectious, non-infectious, which means not able to spread disease, not able to spread disease, non-infectious, okay. Next is un, the prefix un or un, the prefix un means not, okay, un means not, unconscious, unconscious, unconscious means unresponsive or not responsive, unconscious, not responsive, not responsive, unconscious, okay, un meaning not, not un, okay. Next is the prefix for direction, prefix for direction. So we have ab or ab, ab or ab meaning away from, away from, that means abduction, abduction or abduct, to move away from the midline, abduct, move away from the midline. And we have the prefix ad, ad, the prefix ad, which means toward or near, toward or near. Okay, adhere, 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 which means to attach or stick together. To attach or stick together, adhere, adhere, okay, toward, add, toward, near, at. Or another example would be adduction or adduct, okay, which means to or towards the midline, towards the midline, okay, adduct. Next we have dia, okay, dia, okay, the prefix dia, which means true, okay, the prefix dia, which means true, okay, with the example dialysis, dialysis, okay, separation or lysis means separation, the suffix lysis means separation, okay, so that means dialysis, okay, means separation by passage through a membrane, separation by passage through a membrane. So again, dia means true. Okay, another prefix that means true is per, per, per. Okay, as in percutaneous, percutaneous. Okay, percutaneous. Okay, meaning through the skin, through the skin. Percutaneous, through the skin. Okay, next is trans, trans. Okay, also meaning through, through or through. Okay, example is transfusion, transfusion. Okay, introduction of blood or blood components into the bloodstream. Transfusion, transfusion. Okay. Next is prefix for degree. Prefix for degree. So we have hyper, which means over, excess, abnormally high or increased. Hyper, over, excess, abnormally high or increased. Hyper. So hyperventilation, hyperventilation means excessive or excess breathing, excess breathing, hyperventilation, excess breathing. Okay? Hyper, over, excess, abnormally high, increased. Okay. Hypo, hypo means under, below, under, below. Okay. The example is hypoxia, hypoxia. Okay. Hypoxia, which means decrease oxygen in the tissues. Hypoxia. Okay. Hypo, under, below. Next, olig or oligo, olig or oligo, which means few or scanty, few or scanty. Okay. So example is oligomenorrhea, oligomenorrhea, which means abnormally uh, or scanty, sorry, scanty menstrual flow, scanty menstrual flow or oligomenorrhea. Okay, next is pan, pan, which means all, pan. Okay, example is pandemic, 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 which means all. Okay, next we have super, super meaning above or excess, super, above or excess. Okay, next we move to the next slide. Prefixes for size and comparison. Size and comparison, we have equi, meaning equal or same, equilateral, having equal sides. Equi, equal sides. Okay. Next is U, or U means true. Okay, good. Okay, so that is the prefix U. Okay, the example is euthanasia. Euthanasia. Okay, easy or painless death. Easy or painless death. Euthanasia. Okay, so next is hetero. Hetero. Hetero means other or different, unequal. Other, different, unequal. Hetero. So heterosexual pertaining to the opposite sex. Okay? Hetero means other, sexual, sex, or sexual pertaining to sex. So we have pertaining to the other sex. Okay? Next, homo or homeo. Homo or homeo means same, unchanging. Homeo means same, unchanging. Okay? Homothermic means maintaining a constant body temperature. Maintaining a constant body temperature. Homeo, homeo. Okay. Next is iso. Iso means equal or same. Iso means equal, same. Iso equal, same. Okay. Again, iso equal, same. Example, isograph. Isograph. Okay, graph between two genetically identical individuals. Graph between two identically individuals. Okay, iso. Then we have macro. Macro means large or abnormally large. Macro means large or abnormally large. Okay, macrocyte. Okay, macrocyte means extremely large red blood cells. Extremely large red blood cells. Macrocyte. Okay, macro means large or abnormally large. Okay. Then we have the term, the prefix mega and megalo. Megalo, both meaning large and abnormally large. Okay, they mean large or abnormally large. Megalo. Okay, so we have mega bladder as an example. Mega bladder, which means enlargement of the bladder or abnormally large bladder. Okay, next we have micro, which means small, small. Okay, the example is microscopic. Microscopic. Okay, extremely small, meaning extremely small, visible through the or visible under the microscope. Okay, next we have neo. Neo means new. Neo means new. Okay, neonate. Neonate means a newborn infant. A neonate means a newborn infant. Neo, new, neo, new. Next we have normo. Normo means normal. Normo means normal. We have normovolemia. Normovolemia, okay, which means normal blood volume. Normal blood volume. Normovolemia. Okay. Next we have ortho. Ortho. Ortho means straight, correct, upright. Ortho. Straight, correct, upright. Ortho. Okay. Okay. So we have the example orthotic, orthotic, okay, which means correct or preventing deformities. Correct or preventing deformities. Orthotic. Okay. So next we have poikilo. Okay, poikilo, which means varied or irregular. Varied or irregular, poikilo. Okay, so the example is poikiloderma. Poikiloderma. So molted condition of the skin. Okay, poikiloderma. Poikiloderma mottled condition of the skin. Then we have pseudo, 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 which means false, false, pseudo. Okay, which means, the example given is pseudoplegia. Okay, pseudoplegia. Okay, which means okay. Next is re. Re meaning again, back, re. Okay, regurgitation, re, backflow, return or backward return flow of stomach contents. Okay. Okay, now the prefixes for time and or position. Okay, so these are the prefixes used pertaining to time and or position. Okay, so first we have ante. Ante. Ante means before. So antenatal means before birth. Before birth, natal means birth. Antenatal, before birth. Okay. Next we have pre, also meaning before or in front. Pre, before or in front. So example is predisposing, predisposing, okay, which means leading forward toward or leading toward a condition, leading a toward condition, okay, such as disease. Okay, next we also have pro, pro, which means before or in front also, before or in front. So we have the word prodrome, prodrome, okay, prodrome. So meaning symptoms that precedes a disease, prodrome. Okay. Next we have post, post which means after, after or behind, after or behind. Post, after, behind. Okay. So we have postmenopausal, postmenopausal. Okay, which means after menopause, after menopause, postmenopausal. Okay, so next, prefix for position, prefix for position. So we have dextro means right, dextro means right. If dextro means right, what does towards the left means? So we have sinistro, sinistro meaning left, sinistro meaning left. Okay. Okay, sinistro means left, so sinistrad towards the left. Sinistrad towards the left. Okay, so next we have ect or ecto. Ect or ecto, which means out or outside. Out or outside. So we have ectoderm, ectoderm. Ectoderm means outside or the outermost layer of the skin. Oh, sorry, of the developing embryo. Embryo, okay? So ectoderm, outside-most layer of the developing embryo. Okay, ectoderm. Okay, so next we have exo. Ex or exo, away from or outside, away from or outside. Okay, so the example is excise. Excise, okay, which means Okay, so excise meaning to cut out, excise meaning to cut out. Okay, next we have meso. Meso means middle. Meso means middle. Okay, we have mesencephalon. Okay, mesencephalon or mesencephalon, mesencephalon or midbrain, mesencephalon midbrain. So mes or meso means middle. Then we have sin or sim, which means together. Okay, sin and sim means together. So the example is synapse, a junction between two nerve cells, synapse. Okay. Then we have tele or telo, which means end. End, okay, tel or telo, which means end. Okay. Okay, now we move to organ and organ systems. So an organ is composed of two or more tissues with the same function. Okay, and two or more organs with similar function, when grouped together, is called organ systems. Okay, so we have the following key terms: ATP or adenotriphosphate, which is an energy compound of the cell. It is stored energy needed for cellular activity. Okay, next we have carbohydrate. Carbohydrate is the category of organic compounds that includes sugar and starches. Next is cell. Cell, okay, the basic structural and functional unit of a living organism. It is a microscopic unit that combines with other cells with similar function or uh, same composition to form a tissue. Ano yun? Okay, cell. Okay, very good. Okay, next we have chromosome. Chromosome, a thread-like body in the nucleus of a cell that contains genetic information. So again, these are medical terminologies already. They are key terms that you should uh, know by heart. Okay, you should know by heart these key terms because all of these we will be encountering them once in a while in the following uh, chapters or lessons or modules. Okay, next we have cytoplasm. Okay, cytoplasm, the fluid that fills the cell membrane and holds all the organelles. Cytoplasm. Okay. Next, we have the DNA. It is the genetic compound of the cell. It makes up the genes. Okay. And DNA stands for deoxyribonucleic acid. Deoxyribonucleic acid. Okay. Then we have the enzyme. Enzyme, so organic compound also that speeds the rate of metabolic processes. Okay? When we say enzymes, they are substances that speeds up the metabolic processes in our body. Okay? Next, gene. Okay, gene. Okay. It is the hereditary unit composed of DNA and combined with other genes to form the chromosome. Okay? So basically, when we say gene, it is a composition of the chromosome or part of the chromosome gene. Okay, next we have glucose. Glucose means a simple sugar that circulate in our bloodstream. Okay, it is the main energy source for metabolic processes. Okay, It is the main energy source for metabolic processes. And its root words are gluco or gluc and glyco or glyc. Then we have homeostasis, a steady state, a condition of eternal stability, or basically a balanced state, homeostasis. Okay, homeostasis, we have lipid. Okay, a lipid is a category of organic compounds that includes fats. Okay, so the root word of lipid is lip or lipo or lipo. Okay, next we have metabolism. Metabolism, it is the sum of all the physical and chemical processes that occurs in our body. Metabolism. Then cell division, we have mitosis. Mitosis. Okay, basically it means cell division. Mitosis, cell division. Next we have mucus. Mucus, it is a thick body fluid secreted by cells in membranes and glands. Mucus. Okay? Their root words are muc or muco and myco or mic or myco. Okay. Next we have nucleus. So nucleus is the center or the very important part of the cell. It is where the DNA is contained. Okay, nucleus. Next, we have the protein. The protein, okay, another organic compound found in our body. Okay, that includes structural material, enzymes, and hormones. It is made of amino acids. Next, we have RNA. RNA, if there is DNA, we also have RNA. So RNA is an organic compound that is involved in the production of protein. RNA involved in the production of protein, okay, within the cell. So RNA stands for ribonucleic acid. Ribonucleic acid. Okay. Next, what do we mean by DNA? Again, what is DNA? DNA stands for, okay, very good, deoxyribonucleic acid. Okay, while RNA means ribonucleic acid. Okay, very good. Next is tissue. Okay, tissue, a group of cells that acts together for a specific purpose. Tissue. So, two or more cells that have the same or similar function or have the same type, okay, they form together as a tissue. Okay, so the root word for tissue is histo. Hist or histio. Okay. Now we move to the roots for cells and tissues. Okay. So we have morpho. We encountered them. We encountered this earlier. Morpho. Okay. Or morph, which means form. So we have the example polymorphic. Polymorphic, which means having many forms. Poly means many or multiple. Then morpho means form, so having many forms or multiple forms. Next, we have site or cyto. Site, root the site. Then, if we go to use it as a suffix, so it is site. Okay, cyto or site. Okay, which means cell. So the example is cytogenesis or the formation of cells. Cyto means cells. Genesis means formation or beginning or creation. Okay. Next we have nucleo. Nucleo or nucleo, which means nucleus. Okay, the example is nuclear, which means pertaining to the nucleus. Next we have karyo. Karyo. Okay, which means also nucleus. Okay, and the example is karyotype. Karyotype. Okay. So picture of a chromosomes of a cell organized according to size. that is a karyotype. Okay? Again, karyo and nucleo is or have the same meaning, which is nucleus. Okay. Next is histo and histio. Histio, which means tissue. So the example is histologist, and a specialist in the study of the tissue. Histologist. Okay. Histio, tissue. Next, we have fiber or fibro, okay, which means fiber. Then we have the term fibrosis. Fibrosis, okay, abnormal formation of fibrous tissue. Fibrosis, abnormal formation or formation of fibrous tissue. Fibrosis, or a condition of fibrous tissue. In continuation, we have reticulo. Reticule or reticulo, which means network. So the example is reticulum, reticulum, okay, which means basically a network. Okay, we can find this used or in one of the organelles, which is the endoplasmic reticulum. Endoplasmic reticulum, which is basically a series of maze, okay, a maze or a series of pathway. So it is a network. Then we have aden or adeno, which means gland, adeno, gland. When adenoma or adenoma, okay, means tumor of a gland, adenoma. Aden or adeno means gland, oma means tumor. Okay. Next we have papil or papilo. Papilo meaning nipple. Papil, nipple. Papilo, nipple. Papilliform. Papilliform or papilliform, okay? Resembling a nipple. Papilliform, resembling a nipple. Okay? Then we have the mix or mixo, which means mucus. Okay, mix adenitis, which means inflammation of a gland that secretes mucus. Mix adenitis, inflammation of a gland that secretes a mucus. Okay, mix adenitis. Mix or mixo means mucus. Then another prefix or root for mucus is muc or muco, which means mucus or mucous membrane. Okay. Then we have the example mucorrhea, okay, which means increased flow of mucus, mucorrhea. Muco means mucus, rhea means increased flow or flow. Rhea means flow. Increased flow. Okay. Next we have somat or somato. Som, which means body. Okay. Then somatic. We have the example somatic. Somatic, which means pertaining to the body. Okay. Next we have roots for cell activity. Okay. So we have blasto or blast. Blasto is a prefix or root word, and then blast is a suffix. Root that can be used as a suffix. Okay, so blast or blasto means immature cell, productive cell, or embryonic cell. So basically, there are young cells. Blast or blasto. Okay, so the example is leucoblast, which means an immature or a young white blood cell. Okay, leucoblast, an immature or a young white blood cell. So again, blast or blasto, meaning immature cell, productive cell, or embryonic cell, or basically a young cell. Next, we have gen. Gen means origin or formation. Origin, formation, gen. Gen, origin, formation. Example, genetics. Genetics, the science of genes and hereditary, or the science that studies origins of uh, certain genes and other hereditary traits. Okay. Next, we have fag or fago. Fag or fago, which means to eat or to ingest. Eat or ingest. Fago. Okay, the example is phagocyte. Phagocyte, a cell that ingests waste and foreign bodies. Okay, a cell that ingests or engulfs waste or foreign bodies. Phagocyte. Phagocyte, a cell that engulf or ingests or eats a foreign body and cellular waste. Okay? Phago means eat, ingest, engulf. Okay? Next we have feel. Feel means attract, absorb. Feel, attract, absorb. Attract, absorb, feel. So the example here is acidophilic. 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 Okay? Which means attracting acid stain, attracting acid stain. Acidophilic meaning attracting acid stain, acidophilic. Next we have plus. Okay, plus means formation, molding, development. Molding, development, formation, plus. Okay, plus means formation, molding, development. The example is hyperplasia, hyperplasia. Okay, hyperplasia, okay, which means overdevelopment of an organ or tissue. Overdevelopment of an organ or tissue, hyperplasia. Okay. An example for hyperplasia is the BPS or the benign prostatic hyperplasia, or a benign tumor, okay, of the prostate gland. Okay, or basically an enlargement or overdevelopment of the prostate gland. Okay, plus means formation, molding, development. Okay, next we have trop. Trop meaning act to or act on and affect. Trop, act on, affect. Chronotropic, chronotropic, which means affecting rate or timing. Okay, chronotropic, which means affecting rate or affecting timing. Okay, chronotropic, trop, affect on or affect, act on or affect. Then we have tropho, troph, tropho. Okay, which means feeding, growth, nourishment. Tropho, feeding, growth, nourishment. Okay. Then we have the example atrophy, atrophy. Okay, atrophy, which means wasting away or lack of nourishment. Okay, okay. So basically, atrophy, we have the negative suffix a, okay, which means uh, absence, okay, or lack, or no, none, di ba? So trophy means growth, so that is lack of growth. So atrophy, wasting away, shrinking, shrinking of muscle, atrophy, okay? So, okay, now we move to the suffixes and root for body chemistry, okay? Now we have two suffixes, which is the ase, which means enzyme, and the os, which means sugar. Okay, so we must remember this, very simple. When we say ase, it is an enzyme. When we say os, it is a sugar. So the example is lipase. Okay, lipase. Lipase is an enzyme that digests fat or lipid. Lipase. Okay, next we have the example for os, which is lactose. Lactose, okay, which means milk sugar. Lacto means milk, and then os means sugar. So milk, sugar, lactose, lactose. Okay. Next we have the roots. Okay, the root words we start with hydro. hydro, okay, hydro which means water or fluid, hydrophilic, hydrophilic meaning attracting water, hydro means water, philic means attracting. Okay, next we have gluco or glucose. Okay, meaning glucose. So we have glucosuria. Okay, glucosuria, which means presence of sugar in the urine or presence of glucose in the urine. Okay, then we have glyco, also meaning glucose or sugar. We have hyperglycemia. Hyperglycemia as an example, and hyperglycemia means presence of high blood sugar. High blood sugar. Hyper means high. Okay? Then glyco means sugar. Then emia means blood. Okay? Next we have saccharine or saccaro, which means sugar. Saccharine or saccaro, which means sugar. Okay? So polysaccharide which means many sugar, many sugar. Okay, or compound containing many sugar. Then we have amyl or amylo, starch, amyl meaning starch. So the example is amyloid which means resembling starch, resembling starch. Then the lipo, which means lipid or fat, okay, lipogenesis or fat formation, lipogenesis or fat formation. Then another term for fat, another root word for fat is adipo, okay, okay, and the example is adipocyte, a cell that stores fat, a cell that stores fat, adipocyte, okay. Then we have the uh, steato which means fatty, so steatorea which means discharge of fatty stools, discharge of fatty stools. Next we have prote or proteo which means protein. Okay, the example is protease. So remember, if it is an ACE, it is an enzyme. Okay, so protease in an enzyme that digests protein. Or so sorry, protease is an enzyme that digests proteins. Okay, supplementary terms. So that you need to understand and know. Okay, first is the amino acids. So these amino acids are nitrogen-containing compounds that make up the proteins. Okay, next is the anabolism and catabolism. There are two metabolic processes. Okay, the first one, anabolism, is the building phase of metabolism, and catabolism is the breaking down phase of the metabolism. Okay, next is a collagen, is a fibrous protein found in connective tissues. Next is the cortex. When we say cortex, it is the outer region of an organ. Okay, a cortex is the outer region of an organ. Then the glycogen, it is a complex sugar compound stored in liver and muscles. Okay, so when glycogen is broken down, okay, it becomes glucose. Okay, and glucose is the primary source of energy in the body. Okay, next is interstitial. Interstitial between parts, such as the space between cells and tissues. Okay. Next, we have the medulla. Medulla, okay? If the cortex is the outermost region of an organ, so the medulla is the inner region of an organ. Okay, medulla. Medulla also means marrow. Okay, so the root word is medal or medallo. Then we have the parenchyma. Okay, the parenchyma. So the parenchyma is the functional tissue of an organ. Okay, so the parenchyma is the functional tissue of an organ. Okay. Next we have the parietal. Parietal meaning or it means pertaining to a wall. On the other hand, it describes a membrane that lines a body cavity. Okay? So pertaining a wall, parietal. So body cavity. The membrane that lines a body cavity, parietal. So example is parietal pleura. Parietal pleura. So it is a membrane that lines the pleural cavity. Next, soma meaning the body. Okay? The stem cell next. It is an immature cell that has the capacity to develop into any type of cell, or it is called basically as the precursor cell. Okay? Next is the visceral. Visceral. So viscer meaning internal organs. Okay? So AL means pertaining to, so pertaining to the internal organs. Okay, on the other meaning, it is described as a membrane that lines the surface of an organ, of the internal organ. Okay, so visceral, as in visceral pleura. So the visceral pleura lines the uh, uh, is a membrane that lines the surface of the lungs. Visceral pleura. Okay. Okay. Having known the supplemental terms, now we proceed to the directional terms. So these directional terms are very important in radiologic technology, especially in our radiographic positioning. Okay. So in describing the location and direction of a given point of the body, it is always assumed that the patient or the subject is in the anatomical position. The anatomical position is standing upright with face front, arms at the sides and palms forward, and the feet parallel. Okay? So these are the anatomical directions. So we will take them by pair. Okay, first, the anterior and posterior, or the anterior or the ventral. Okay, when we say anterior or ventral, that means towards the front of the body. Okay, sa harap ng body. When we say posterior or dorsal, likod. Likod ng body. Okay? Posterior, dorsal, likod. Anterior, ventral, harap. Okay? Next, medial and lateral. Medial and lateral. Okay? When we say medial, it is towards the midline of the body. It is towards the midline of the body. And where is the midline of the body? If we draw a line dividing our body into left and right, equal left and right, so the midline of the body will pass through our forehead, in the middle of our forehead and nose. Okay? So when we say medial, it is closer to that line. Okay? And when we say lateral, it is towards the side of the body. Okay. So as we said earlier, we always assume that the subject or the patient is in the anatomical position. Okay. In our forearm, there are two bones. We have the radius and the ulna. Okay. We have the radius and the ulna. In the anatomical position, the radius is located laterally. Okay? The radius is located laterally, and the ulna is located medially. Okay? So that means the radius is the bone that can be found in towards the side of the body. Okay? And the ulna is the bone in the forearm that is nearer to our midline. Okay? Next, we have the proximal and distal. Proximal and distal. Okay. When we say proximal, okay, toward the side of the body. Sorry, proximal, nearer to the point of attachment or a given reference point. Proximal, okay, nearer to the attachment. Point of attachment, which is the joint, okay. Next, we have distal. Ang distal naman ay farther from the point of attachment, which means malayo. Okay? So, ano ba yung mga point of attachment? So, the point of attachment we have in the body is the shoulder. Okay? Sa upper extremities, it is the shoulder. The shoulder, the elbow. So basically, the shoulder and sa legs, the lower extremities are the thigh. Okay? So when we say proximal, proximal humerus, okay? So the bone in our bone in the arms is what we call the humerus. Okay. So when we say humerus, proximal humerus, it is the part of the humerus, okay, that is near the shoulder. It is near the shoulder, proximal humerus. When we say distal humerus, it is the part of the humerus that are closer to the elbow. Okay? Again, pag sinabing distal, malayo sa point of attachment. The point of attachment in the upper extremities is our shoulder. Okay? So when we say distal humerus, so it is the part of the humerus closer to the elbow and farther or farthest from the shoulder. When we say this proximal humerus, it is the part of the humerus that is closer or closest to the shoulder. Okay, clear? Okay, next we have superior and inferior. Okay, when we say superior, above. When we say inferior, below. Above, below. Taas, baba. Superior, taas. Inferior, baba. Okay, next we have the term cephalad or cranial or cephalad. Then we have the caudal or caudal. Okay, so cephalad means towards the head. Okay, cephalad towards the head. Then caudal towards the tail. Okay, it is primarily used when we are angulating our X-ray tube. Okay, so again, cephalad towards the head, caudal or caudad towards the tail. Next, you have superficial, external, and deep or internal. So superficial, external. So close to the surface of the body, superficial. Okay, deep, close to the center of the body or internal. Okay. Okay, next we go to the body planes. Okay, to the body planes. Okay, so a frontal plane is also called a coronal plane. So the coronal plane or frontal plane is made at the right angles to the midline and divides the body into the anterior and posterior part. So which means we divide the body, okay, into the front and back part. So that is the frontal or coronal plane. Now, on the other hand, the sagittal plane is a plane that passes from front to back and divides the body into right and left portions. Okay, if the coronal plane divides the body into the front and back, sagittal plane divides the body into left and right portion. Okay, while a transverse plane is a plane that passes horizontally, dividing the body into superior and inferior parts. Okay? Superior and inferior parts. Okay. So that is the image of a coronal plane, a sagittal plane, and a transverse plane. Okay? Okay. However, if the body is divided into uh, when the plane divides the body into the posterior and anterior parts equally, it is called mid-coronal plane. Okay, mid-coronal plane. Okay. And if the sagittal plane passes or divides the body into an equal right and an equal left portions, so it is called sagittal plane or medial plane. Okay? So if there is the word equally or equal parts, okay? So you must add mid in the in the name of the plane. So mid sagittal plane or mid coronal plane. Okay? Okay, now we move on to the body cavities. So the different internal organs in our body are located into what we call the dorsal and ventral cavities. Okay, so these cavities are spaces where the internal organs are located. Okay, we have um, two cavities in the dorsal cavity, which is the cranial cavity, and the spinal cavity or spinal canal. On the ventral cavity, okay, we have the thoracic cavity, which is separated from the abdominal cavity by the diaphragm, and the pelvic cavity. Okay. Sometimes the abdominal cavity and the pelvic cavity are being joined together, okay, and they are called as the abdominopelvic cavity. Okay. So the large membrane that lines the abdominopelvic cavity and covers the organs within it is what we call the peritoneum. Okay. Okay, so this is the image where you can see the locations of the uh, different body cavities. Okay. So as you can see, there is a division between the thoracic cavity and the abdominal cavity, wherein there is no division between the abdominal cavity and pelvic cavity. That's why it can be called as abdominopelvic cavity. Okay, next is the body regions. Okay, so for orientation, the abdomen can be divided by imaginary lines into 9 regions and 4 quadrants. Okay, the 4 quadrants are more simple and however, it is less precise. So basically, the 4 quadrants are the following: the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. Okay. That comprises the four quadrants of the abdomen. Okay. The RUQ, the LUQ, the RLQ, and the LLQ. Okay. How about the 9 regions of the abdomen? Okay. So the 9 regions of the abdomen, okay, are the following. So we have the epigastric region. Okay. Epigastric region, epi means above the stomach. Okay, epi. Okay. Next we have in the same row we have the right and left hypochondriac region. Okay, hypochondriac. Hypo means below. Okay, below. Um, Chondriac means cartilage. Okay, so basically it is near the below the rib cartilages. So that's why it is called the hypochondriac region. Okay, so left and right hypochondriac region. Then we have the umbilical region. Basically, it is found near the navel, okay, or the umbilicus. And then the right and left lumbar region. Right and left lumbar region. Right lumbar region, left lumbar region. Okay, so the lumbar region is the region around the low back. Okay, low back. Okay, or the lumbar region of the spine. That's why it is called lumbar region to begin with. Okay, okay, the last row of the 9 regions is the hypogastric region. Hypogastric, hypo below, okay, below the stomach. It is the region below the stomach, hypogastric. Okay, and its right and left is called the iliac region. Okay, okay, because it is near the hip, particularly the ilium. Okay, it is also called as the inguinal region. Okay, it is right iliac region and left iliac region, or right inguinal region or left inguinal region. So that are the 9 regions of the abdomen. We have the epigastric, the umbilical region, the hypogastric, the right hypochondriac, the left hypochondriac, the right lumbar, the left lumbar region, the right iliac, and the left iliac region. Okay. And now we move on to the positions. Okay. So it is also needed in the radiographic positioning and other medical procedures. Okay. So that we will not be disoriented or confused when we hear the following terms. Okay, so anatomical position. So we already described that. And next we have the decubitus position. Okay, so basically lying down. So specifically according to the part of the body resting on a flat surface. So example, left or right lateral decubitus, or dorsal or ventral decubitus. Okay, so lying down. So the part said, or the part given, should be the one lying down. Okay, if it is the left lateral, so it is the left lateral side of the body lying down. Okay. Next, we have the dorsal recumbent position. Dorsal recumbent position. So basically dorsal recumbent, so lying back, on back with legs bent and separated. feet flat, okay, dorsal recumbent. Then we have the Fowler's position, on back again with the head of bed raised about 18 inches, knees elevated, okay? So that is Fowler's. Mataas or naka-raised yung head ng bed. Then we have the Kraske, okay, the Kraske or jackknife, Kraske or jackknife position, which is prone. Okay, when we say prone, it is face or lying face down, nakadapa, prone. Okay, so jackknife ay prone with the buttocks raised. Okay, with the buttocks raised, that is jackknife position. Then we have the knee chest position. Knee chest position on knees with the head and upper chest on the table, arms crossed above the head. Okay, that is the knee chest position. Next, we have the lateral recumbent. So lateral recumbent on the side with one leg flexed. Arm position may vary. Okay. Then we have the lithotomy position on back with legs flexed on the abdomen and thighs apart. So lithotomy position is the position used while giving birth. Okay. Or any examination in the vagina. Then we have the, okay, sabi na kanina, the prone position. Then we have the Sims position. On left side, right leg drawn up, high and forward. Okay, with left arm along the back, chest forward resting on the bed. So basically, Sims position is like your position sleeping while hugging a bolster pillow or your hot dog pillow. Okay. Next, we have the supine position. Supine position, lying face up. So if prone position is nakadapa, ang supine position is facing up or nakatihaya. Okay? And then we have the Trendelenburg position, the opposite of the Fowler's. So in Trendelenburg, the head of the bed is tilted, okay, 45 degrees angle pababa, ay lowered, okay, tilted lowered by an angle of 45 degrees. Okay, so that is Trendelenburg position. Okay, next is words pertaining to the body structures. So roots for the regions of the head and trunk. So we have the cephal or cephalo, which means head. Okay. Cervico means neck or the cervical spine. Okay. So cervicofacial means pertaining to the neck and face. Then we have thorax or thoraco, which means chest or thorax, or the thoracic vertebra, okay, or vertebrae. Okay, so extrathoracic means outside the thorax. Next, we have the abdomino or abdomino, which means abdomen. So we have intra-abdominal within the abdomen. Then celi or cilio, also meaning abdomen. And the example is celiac, which means pertaining to the abdomen. Then we have the lapar or laparo, which means abdominal wall. Abdominal wall ang laparo. Okay. Next, kanyang example is laparoscope. Okay. Laparoscope. Okay. Instrument viewing the peritoneal cavity through the abdominal wall. Okay. Next, we have the lumbar region or lower back. Okay, ang meaning niya ay lumbar region or lower back. So meaning thoracolumbar pertaining to the chest and the lumbar area. Or basically, thoracolumbar means pertaining to thoracic and lumbar vertebrae. Okay? Then we have periton or peritoneo, which means peritoneum. Okay? So the example is peritoneal, pertaining to the peritoneum. Okay? So again, the peritoneum is the lining that covers the organ in the abdominopelvic cavity. Okay? And the last slide is common terms for the body regions. Okay? So we have cranial, cranium, facial, frontal, ocular, oral, thoracic, mammary, axillary, okay, antecubital, inner elbow, navel umbilical, groin inguinal, pubis or pubic, palm or palmar. Okay, for the fingers and toes, we have phalanges, wrist carpal, forearm antebrachial, arm brachial. Okay, then thigh, we have the femoral. Okay, then foot pedal, hand manual. Okay, then leg crural, ankle tarsal. Okay, then at the dorsal naman. So we have the crown or parietal, the base of the skull occipital, the cervical, the deltoid, the scapular. Okay, and dito sa harap pala nakalimutan natin yung clavicle, okay, or the collarbone. Then we have the lumbar, the brachial, the iliac, the sacrum, sacral or the gluteal or buttocks. Okay, the gluteal maximus yung nasa buttock muscle. Then we have the popliteal, back of the knee. Okay, and the sole of the foot is what we call plantar. Okay. Okay, so that ends our lesson, our module 1. Okay, thank you for listening and goodbye and thank you.